All right, John, tell us a little bit more from your neck of the woods.
Yeah, thanks so much. I'm John McDonald. I'm an orthopedic sports medicine and arthroscopist in Austin, Texas. I tell you, one of the biggest concerns that I have or that I see come into my clinic is catastrophic thinking of, will I ever play my sport again? Or they have an ACL tear, they need an operation, there's an 8 to 9 month recovery. What happens to my mental health through that process? And we help those patients and the parents and the families and the friends navigate those situations too. So it's not always about just fixing the ACL and then handing them off to the physical therapist or the family. We want to make sure we support the athlete all the way through the process.
Tell me a little bit more about what value you see orthopedic sports surgeons providing to the community, whether that be from their clinical practice or on the sidelines.
I think the orthopedic surgeon, especially the sports medicine provider, provides a tremendous value to the community. We volunteer our time on the sidelines of high school football and basketball games. We try to support the athlete out of season as well. And as Dr. Ellis said earlier, really help be the captain of the ship from a musculoskeletal perspective and provide a good diagnosis for the athlete so that other providers can help treat those soft tissue injuries even if they don't need a surgery.
Talk to me a little bit more about the value of an appropriate diagnosis and potentially the value of coming to an orthopedic sports surgeon first to get that diagnosis.
Yeah, I think it's really important to have a good history, a good physical exam, appropriate imaging. We don't MRI every single person just to get a diagnosis. That's not a great use of cost-effective medicine. When an MRI is necessary, it's really an important conduit to help getting a good diagnosis on occasion. But to know what we're treating is maybe the most important thing. And we don't always get it right the first time, nobody does. But to be able to work through a differential diagnosis, find out what the right answer is, and then help create a treatment plan, gets the patient back to the field faster, back to the court faster than just treating a generic pain problem.